Welcome back to What's Now. Have you avoided seeing your doctor for routine physicals and checkups? Well, don't do that. It's important to make sure you stay up to date with all of your medical needs despite these difficult times due to COVID-19. So how can you do this safely? Well, we have some information right now.
Among the troubling consequences of COVID-19 has been a sharp decline in doctor's visits and vital screenings. Joining us with some tips on getting back to the doctor safely is the Chief Medical Officer, Head of Technology and Performance at UnitedHealthcare Medicare and Retirement, Dr. Saurabha Bhatnagar. Thanks for joining us, Dr. Bhatnagar.
Thank you, Christine, for having me.
So we know doctor visits have been down during the pandemic, but what did the decline look like? And are you finding people are still hesitant to go to the doctor?
Yeah, the decline was fairly significant. So the Centers for Disease Control just released a report last month saying 4 out of 10 Americans have either avoided or did not go into annual preventative care or other preventative screenings, such as colon cancer or breast cancer screening during this time of the COVID-19 pandemic. And some of it was understandable. During the early days of the pandemic, there was more hesitation to go in the doctor's offices. Doctor's offices were trying to figure out how best to serve both COVID-19, which was new, as well as patients. Now, I think that has significantly changed, and doctors' offices and clinics around the U.S. are ready to receive care in a safe manner for our patients.
And what are some of the consequences of delaying medical care, especially for older adults?
So delaying medical care can have not just short-term, but also long-term consequences. So we talked about breast cancer and colon cancer screening. About 80 to 90%, there's been a reduction from the previous year of those screenings. And the long-term effects of that, as the National Cancer Institute just released some data on this that predicts that over the next decade, there'll be an increase in about 10,000 deaths just due to some of that avoidable care if diagnoses were either made earlier or preventative screening was able to be done on time.
And do you have any tips to help people get back to their doctor safely and effectively?
Yeah, the doctor's office is one of the safest places that you can go right now. So a lot of the things that many people are used to doing in their day-to-day lives, even when they go to the grocery store, such as wearing a face mask, better hand hygiene. At the grocery store, in the checkout lines, you have those stickers on the floor that keep you 6 feet apart. Doctors' offices have that and much more. They even have smart scheduling available. So some doctors' offices may have you wait in your car until the time of your appointment, or have only 1 or 2 people in the waiting room. So unlike last year or many years before, where you'd have a lot of rows of seats next to each other in the waiting room, you'll no longer see that because the doctor's offices want to keep you safe and also keep their staff safe.
And what are some alternative options for people to get the care that they need?
So some things that people can do if they're still a little concerned about going to the doctor's office is telehealth services, for example, or at-home services. Telehealth, for example, in our UnitedHealthcare Medicare population, so members who are age 65 and older, last year, only about 0.1% of members use those telehealth services. This year, we've seen a staggering 40% of our Medicare members take advantage of those telehealth services to talk to their doctor, which is not really good for emergency care, but for a lot of other routine care, such as adjusting your medications or annual visits, it's pretty good for that. So I always encourage folks to at least talk to their doctor's office about telehealth services. And then if you're a UnitedHealthcare Medicare member, we also have additional services at home. So we can bring a clinician into your home to be able to do some of that annual wellness visit, annual exam, annual checkup that is so important, not just for short-term, but long-term health.
And anything else we need to know, and where can we find more information?
This is a really important time of the year, not just because of COVID-19, but also to get your flu shot. We're getting into the end of the year, November, December. So I'd encourage folks to first get their flu shot. And then if they're looking about health plans next year and what healthcare services they may need, I encourage folks to go to uhcmedicarehealthplans.com, and they can find out a lot more information about at home, in office, or digital healthcare services that UnitedHealthcare offers to its members.
Well, thank you so much, Dr. Saurabha Bhatnagar, for joining us today here on Park City Television with this important information about making sure we don't miss those doctor's appointments.
Thank you, Christine, for having me.